Yes, hello, I'm Sam Jahari,
Good afternoon, this is Charlie Buckley.
and we are Community Parent. Today we have a special guest with us, Kristen Centers from the Odyssey House. Hi Kristen, welcome.
Hi, thank you for having me.
Can you tell us a little bit what your job title and what you do at the Odyssey House?
My formal job title is Director of Public Relations and Women's Specialty Services. Essentially, what I do is actually make sure that people are aware of the services that our program provides, have an increased awareness of some substance use treatment resources around, and also make sure that our organization maintains what's called women's specialty standards. We do comprehensive family treatment, so we serve pregnant women who are parenting, fathers who are parenting and don't want to be separated from their children, extended family, and so making sure that we meet specific local and national guidelines regarding that.
Can I ask you something, Kristen? Now, do you find that addiction has really increased, or is it pretty much just stays the same, just the drugs change?
Actually, I've seen an increase in addiction. Back in 2009, we noticed something kind of different that was happening. We had some pretty stable, there's this thing called TEDS data, and basically TEDS data is treatment episode data, and we gather it on intake about people that are coming into the program. And in 2009, we noticed a change in the TEDS data. We noticed that people were coming in a lot younger for their first episode of residential treatment. The age went down from about mid-30s to early 20s, which was, of course, a huge drop to be in that level of care, which is pretty high. The other thing we noticed is that for decades, just decades, when you ask somebody coming into treatment, what's your first drug that you ever used, we were listening to either marijuana or alcohol or both. And then we went from marijuana or alcohol to OxyContin. And it went from zero OxyContin to 25% OxyContin, which is, again, this huge, upswing. And then we started seeing some really major changes in people that were seeking substance use treatment. The age had changed drastically, the drug had changed drastically, and our organization has changed drastically in response, because now we're looking at different levels of care to meet different needs of people over a different time frame, and how all of that coordinates into a wider service array. So now our program has grown to where we have recovery housing, so that we can make that residential connections go out over a longer period of time, so we can actually provide 3 years of support on limited funding. And so we've seen an upswing.
Now, information that I've got is 10% of us have these addiction genes. Is that about right?
I've heard different amounts of what would be considered an addictive gene. So we know that there are some people, for instance, who can process alcohol faster than others. Which means that they can drink a lot more than their age peers. So that that first time that somebody got really intoxicated and then you had the hangover and just promised yourself you would never do that again and then never did that again, that actually keeps you out of trouble. But then there are those who can actually drink more than everybody else, and suddenly that makes them cool. So we look at which kinds of genes that you would have. I don't know if I would put it at 10%, because I would consider that gene is promoting substance use. If you don't have that first hangover that keeps you from thinking, oh, I want to do that again real quick, then you're going to end up with some different problems. So I don't know about 10%, but I know that there are people who just their body responds differently to chemicals in alcohol and other things, and that it's harder for them to be able to, I was to say they were impossible for them actually to do what their peers are doing and have that done socially.
Yeah, I know when you go out and research the data, it's kind of like trying to take a sip of water out of a fire hose. There's so much that comes down the pipe at you.
Mm-hmm.
And it is well documented that there is a genetic component, but there's also an environmental component, social components, and some other things. Now, you say you've seen an increase in addiction. What I heard you say was you've seen a change in the types of addiction you're treating.
Yes.
So has there also been an increase in people seeking treatment? And if so, it's kind of a two-part. If so, is that because of I don't want to say the severity of the drugs, because they're all bad, or do you think it's because of education and awareness, or is some of the stigma finally being removed that it's okay to ask for help? And what do you see as the contributing factors for that, both the change in the drugs and hopefully the rise in people asking for help?
I think all of the above. We really looked at the idea that at one time, for instance, I work in women's specialty services, so I work with pregnant and parenting women. And at one time, nobody wanted to admit that a mom was an addict. And so reducing the stigma so that women are seeking treatment prior to being mandated is a huge part of that. Also, recognition of the variety of different types of treatment that are available. People are less likely to say they're in treatment for something else and admitting that they're in treatment for drug and alcohol use. There's more treatment available. A lot of people had really good results in some of the social programs like AA and NA, which that's Alcoholics Anonymous. So those numbers you really didn't see. However, when you start looking at drugs like heroin, they're receiving medical services along with the social services aspect, where alcohol not so much. So then you're seeing the more rise in people being documented as receiving substance use services, whereas the whole point of AA is to be anonymous. We don't really get good numbers out of there. So I think that all of the above are ways in which we've seen this increase in people that are documented as having addiction services. And then there's the mental health coordinated aspect of it, where we are seeing more people actually getting true integrated substance use and mental health care, where at one time it was an either or. And so people that were receiving mental health services, the substance abuse was this off to the side, also known problem. Whereas now when that's integrated, you actually have them acknowledging both in the data. So
the term cross-addicted then, I hear that a lot around the tables.
Right.
And some people will say they're cross-addicted alcohol and opiates. Other people say I'm cross-addicted alcohol and bipolar. And what's the proper, is it two addictions, or is it a mental health issue, a diagnosed mental health issue and an addiction, or can be both?
I think cross-addicted is mainly looking at two substances.
Okay.
Co-addicted or co-occurring or dual diagnosed is having a mental health disorder and a substance use disorder. And then we add the extra fun part of it, where when you would have, I guess you would call it tri-addicted, where you have a chronic pain disorder, or you have a chronic health disorder, which also affects your ability to be completely abstinence from drugs because of the treatment for pain, the treatment for mental health, and then you have the addiction piece, the drug addiction piece.
Now, I read somewhere that addiction is non-curable. Is that right?
Explain curable.
Well, this is what I got, that it's non-curable, but you can manage it.
Right, you can sustain long-term recovery. I don't know if I want to say cure, because I look at it as the same way that you might want to look at, for instance, obesity. You can lose 150 pounds. However, you're going to spend the rest of your life being conscious of the fact that you could gain 200 quite quickly, because you've been at, you've been 150 pounds overweight. Much the same way that you can look at, my grandmother was food managed diabetes. She was never on insulin, but she managed hypertension and diabetes with her diet very carefully for my entire life so I mean, that's one of the things to say cured or really well managed and sustained recovery, where it's not imposing on any of your levels of functionality and you're not demonstrating any symptomology. are you at risk of having your addictive behavior and that coming back? Absolutely. Probably more than others. So again, it's one of those things that going from not or being an alcoholic and receiving treatment for alcohol, that means a commitment to a lack of alcohol in your lifestyle.
Every time we open up the newspaper, it seems like someone has done something stupid because of their addiction. Yesterday, Detroit news. A grandmother left her heroin out, and her grandson got it and took it to school.
Right.
It seems like a few weeks ago there was an article in the paper about pregnant women, that are using. Here we're going to give them more time in jail. It seems like, since the 70s we've had this war on drugs, and it just seems like there's more drugs coming in and there's more drug use. It hasn't really put a damper on this, but it seems like we have a lot more people in jails, but the addiction's still rising. Do you when we send people to jail, it doesn't seem like they get any kind of treatment.
No. It's one of the things that I think is, looking at the corrections field is it depends on what you want out of corrections. If you want punishment or you want rehabilitation. And recovery requires rehabilitation. It just does. And so, to me, the most powerful part of treatment for drugs and alcohol is hope. And I don't know how you convey that in a correction setting. And so I just don't. I don't know how you can do that. And I don't know how you can have somebody develop and design a drug-free lifestyle and have hope for being able to build a life for themselves in that situation. I just don't see how that's effective. So one of the things we look at is having good reentry programming. There's some really good programs that are going into correction settings and helping support that. But I, of course, would like to see alternative sentencing. This is one of the things that I've seen to be very, very powerful. Of course, I've heard people that have left our program and said, I would rather do my time than be here any longer, and that can be a choice. However, I think that if we mandate people to treatment rather than incarceration and long-term incarceration, that in the long term we're going to get better outcomes. And quite frankly, in comparing the cost, it's less expensive. So I just look at the idea of being able to have a variety of good treatment options.
This is your field. Why do you see that our government really isn't looking at these different avenues? If it's less costly for us, it seems like that would be a lot better way to go, to treat somebody that for a sickness than to just lock them away.
One of the things I think that's really is frustrating and it's very confusing is that our government, the way that it's structured is very much siloed. And so we have these different, the offices of in DC, and so they have all these different budgets, and so we don't really recognize, we don't get good information out of, for instance, what the substance abuse funding is involved with the BGA versus the Health and Human Services, which is all these different programming, and they have a tendency to kind of be, this is our money focus, and how to get that spread out and looking at real costs. There's also, we're now integrating healthcare, mental health, substance use, corrections, and recognizing that in more cases than not, the same person is actually receiving services from all of the above. And of course, 4 times the funding because they're doing that, and then looking at how integrating that in. And then you mentioned pregnant women. If your infant spends 30 to 45 days in NICU after birth, Then there's family court, and then there's follow-up, and then there's, for instance, education needs going into the school system at 4, 5, 6 years old. Now we're talking millions of dollars by the time we get to where this child's through high school. Early intervention, long-term sustained recovery, you're looking at the idea of saying, well, it could be $15,000, $20,000 that we're paying a year in the first year. And it's like, okay, well, let's compare $20,000 up front to $1 million back end. I think that's a savings. But it's very hard to see. But it's very hard to see that, especially when we work in a system which, you know, a lot of times politicians are put in a position where they have to show big money savings up front in a very, you know, in a re-election system that's every 4 years. And so I'm talking about a 20-year savings or an 18-year savings. We really put people that have very good intentions in a bad spot, because they're looking at, I have to show these outcomes. I can't necessarily promise the people who are putting me in office that this is what I'm going to do, and you're going to see the results of 12 years after I'm out of office. For some reason, human beings just don't like to hear that kind of thing. We don't like to hear about
gratification.
Right. And so it's one of the problems, I think, that is just part of the nature of how public service organizations and nonprofits and government-funded organizations and things work, is that it's hard to get everybody to get at the same table and share resources and funding and really look at long-term solutions. I think as children we understand share increases our resources. As adults we forget that. So it's
about me now.
And again, it's part of the things when we have like grant opportunities are competitive. At first that's competitive funding available. And you just started it out as a competition. Right. I'm talking to a football coach, implies we both, well, somebody wins, somebody loses. Instead of we both go out there and win because we both played our best. And so looking at the idea of, you know, if it's a competitive process to see who wins this, we automatically start going into that competition mindset instead of saying, I refuse to play that way. Everybody is going to benefit because this isn't about me winning. This is about somebody who's this grandmother who's struggling with an addiction. And obviously her grandson is either over or she's trying to raise a grandson at the same time, which, you know, how do you help everybody out of this one? Right. It's a mess.
Just, you know, it almost seems like you have to change the metrics and say, okay, winning versus losing isn't what happens today. We have to look at the long-term impact and, you know, what the results are of that.
Absolutely.
And then it's getting the data. Again, because you're going to have all these different departments that are collecting very specific data for their funding sources.
Right.
And who's going to aggregate all that?
Absolutely.
Now I want to back up a little bit. You said you're seeing this big thing with the oxycodone or codone or whatever it's called. But I came across this thing, I think Jesse Ventura, he put it up, and it says Big Pharma is just a big cartel. It says cocaine street value $20,000 a kilogram, oxycodone street value $1 million a kilogram. So we have this rise in the opiates or these prescription drugs, and that's why there's also a rise, I think, of the heroin.
Yes.
Is that true? About 4 out of 5 heroin users start with prescription drugs.
Absolutely.
I was at an opiate conference, and they said between 12 and 13-year-olds, the new high is the prescription drugs.
Yes.
Well, you know, here's what I don't understand is why do we need to lose so many people before our government says, hey, you know, it's like this the same thing with the cigarette makers. They knew exactly how harmful it was, and it was like forever before they said, oh, okay, now it's time we can, you know, take them to court and make them pay. But all this, the whole thing is, they're in the same bed together, our government and these big companies, you know? And it's the same thing with Big Pharma. I think what's gonna happen is, as a people, we're just gonna say enough is enough and make our government say, you know, go after these people and put a stop to it. You know, it's like that Zohydro, is that what it's called? Zohydro or Zohydro or whatever?
The new one.
The new drug, you know. Here all the doctors are telling the FDA that we don't need this another pill on the market. We have plenty of pain pills.
Zohydro.
You know, but it didn't matter. They still passed it, and now it's available. And now I was listening to Dr. Us, and he was talking about this Zohydro, and he just broke it all up right on this table. And he says, now people smoke this, you know, people snort this, and this is where people die. Why do we, you know, is it just about the money? Is that how these people think?
Well, it's PACs, follow the money. I mean, Sam, right here, you just mentioned it, and it said that the opiate Zohydro was ultimately approved by the US FDA, and the endorsement went against the recommendation given by the agency's own advisory panel. The panel voted 11-2 against approving the drug, but the FDA argued its availability is necessary to help patients unfazed by current medication. Baloney.
Well, what's the difference between this and the Vicodin? They took the acetaminophen or what?
The
Out of it. Yeah.
Aspirin.
You know, I think a lot of times that's why they put the extra stuff in it, just so it can't be smoked or it can't be broken up like that. Is that right or no?
That's the idea behind it. One of the things too is, like, for instance, Vicodin is very fast acting. It comes and goes very quickly, and so looking at the idea for, you know, there is there's a valid need for pain medication out there. And that there's a valid need to be able to provide people with long-term solutions to chronic pain. I mean, that's valid. OxyContin is prescribed and was, in my understanding is the intention prescription was, you know, end-of-life pain management. This is a hospice care drug. We don't want people to suffer. We just don't. One of the things that we have is we have a lot of overprescribing.
Oh, gotcha.
And what do you do when your dentist gives you 30 instead of the 10 you need? You put it in your medicine cabinet, it's readily available. We've made alcohol very hard for adolescents to get a hold of. We've made marijuana very hard for adolescents to get a hold of, but there's 20 Vicodin in pretty much every medicine cabinet in the country. That to me seems like the larger problem and concern, is that we have, you know, children or adolescents, 12 to 16, 17, 18-year-olds are going to find something. And so that's what they're finding. It's at grandma's, it's at their aunts, it's at their neighbors, it's at their own houses. There's a lot of it. They put people in a position, or I should say but your copay is $10 regardless of whether or not you get 10 or 30. And so the mindset of most people is, well, if I'm going to pay the same copay, I'm going to get the 30,
Right.
Especially if I have to take this over a long period of time. I mean, there's a lot of the policies and procedures, I think, should be looked at and modified along the way, looking at the idea of being able to protect. That's why I'm really happy with the drug take-back programs, is that what...
Yeah, that was going on today, isn't it? I think I saw something on MLive where one of the police departments was doing the prescription drug.
Absolutely.
Yeah, today.
Absolutely. And in having, you know, people who are, again, you know, OxyContin is an end-of-life drug. Somebody who passes away has all this extra medical equipment and drugs and all these. And to have somebody that's got all this, I mean, what do? You pack up the 80 remaining OxyContin and drive somewhere with it? It just puts people in a very bad position in most cases to be able to get rid of this. And that's where we have that accessibility for. Again, I don't want to say that we don't have, as the medical community, I mean, there's a legitimate need for pain medication, for again, mental health drug like Klonopin and some of these other that treat mental health conditions, and that's a legitimate need for that. And I think the bigger problem is looking at why do we have such a surgence of people that are using it for other than intended. That, as you know, some of this is not new. I mean, heroin, our whole program was founded on a heroin epidemic in the late 60s where people were coming back from the Vietnam War. So obviously heroin's not a new problem. It's a very, very old problem. But we're seeing an upswing on this, and that to me is what we should be focusing on, is what's going on in our society and our culture where these really strong drugs seem like fun for adolescents, because I can't imagine being in a position where I go to a party and everybody just wants to nod out. What's going on with that? Our kids are really thinking nodding out is better than going out having fun with their peers. That to me is what we should be looking at, is what are we doing with our teenagers that is considered a good time.
Yeah, what's so bad that you need to escape from?
That you literally just want to nod out from.
Right.
And I look at something like within the city of Flint, where all I hear about is how horrible things are. Well, now that starts to make sense, where if the only thing I hear all over town is how horrible the future is, now nodding out sounds,
Let me sleep it away.
yeah,
let me just check
wake me up when September comes. And instead of being able to look at, do we need new options for long-term sustained pain management? Okay, I can see the argument over the recommendations and wanting something that's longer acting and has fewer side effects and can possibly be more affordable, and you wanting to be able to make sure that people receive appropriate medical care. I'm more worried about what's going on in our culture, in our society, that again, teenagers are thinking, taking the amounts and using the amounts that they're doing, and how quickly that's moved. That's frightening.
Before, because that is a societal and a family issue, and I don't think I don't think we'd be doing our job if we didn't discuss that. Before we do, I want to touch on one other thing that you mentioned, that both of you have mentioned, and that's the doctors. Mm-hmm. And I don't want to take the doctors as a profession and throw them under the bus, because there are some very, very, very good doctors.
Yes.
I was blessed to have one of them, but I was also cursed on the other hand. After 30 years of increasing opiate prescriptions for legitimate reasons, I was sent out to a pain management clinic out in Lansing, mm-hmm. to supposedly the best pain management doctor in the state, and within 3 months I was on 80 milligrams of OxyContin 3 times a day. Mm-hmm. Looking back on that, I'm just like, that's where I saw a chronic illness just go right through the roof. Everything just blew up. Now, I know there's accountability as far as the DEA is concerned, and their licensing and some other things, but it doesn't seem, from my own experience, if you come in with a legitimate medical need, it's like they don't even dig any further. It's just, okay, you've been on this, and this for this many years, well, the next step is this. And the alternatives weren't discussed. Mm-hmm. And there are alternatives.
Absolutely.
Maybe not as good, maybe not as fast acting. Again, the instant gratification. It's so easy to take a pill and the pain goes away. But how? Sam, you were talking about. You've got the doctors, you've got the pharmacists, you've got the drug companies, you've got the PACs, you've got all these different people, and all these different entities. It's so enmeshed. I don't know how. I don't even know where to start. It's so overwhelming. I guess that's the problem. That there's, you can focus on one area, but there's 5 other areas, and then once you're hooked, well, then if you, like what Sam says, you take it away. Well, now either you go into treatment or you go to the street. Mm-hmm. and it's scary.
Well, I think the big thing, as a society, we have to admit that we're failing somehow, somewhere, you know, between our government, our doctors, the DEA, all of us all together. We have to come to the table and say, look, this isn't working. We have to find a different solution. And it's not happening. You know, it's like you go to a party, and one person will say, I got a headache, and 10 people will say, oh, I got a Vicodin, and I got a Xanax, I got this, I got that. Everybody's a pharmaceutical, you know? And we think that these drugs are okay because they were prescribed by a doctor. Which I'm not putting down that profession, don't misunderstand me, but something's not right here, you know, and you know, they're doing all the stuff about when you get prescribed something, they put it on the computer so you can't shop different doctors to get this and stuff, but not everybody follows up or puts it right on the computer right then or whatever. You know, 20 years ago, I was looking at a supplement, and there was this doctor talking about it. And he says, you know, all these different medications, they have side effects. And he says, I see a patient every 5 minutes. He says, I don't have time to look at all these side effects of these different drugs. You know, they put it in this book, you know, but the book is downstairs, you know, I probably have never even looked at it. He says, one of the side effects to this drug that I gave somebody was breast cancer. And he said, I had this lady that ended up with breast cancer. And she's like, Doc, why didn't you tell me, you know, that this was a side effect? And he's like, because, he says, I'm a doctor. He said, within 5 minutes and you tell me what's going on, I'm writing a prescription. You know, we think that there's a pill for everything. And a lot of times with the side effects of these different drugs, you're better off with what you got.
Right.
You know, if you read a lot of the side effects, it drives you crazy. You say, oh my God, I don't want this, I don't want that. No, I don't want this.
But I think as an informed patient, we're so numb to that list of possible side effects because they just cover their ass. I mean, they list everything under the sun. If one patient in that 1,000-patient study, you know, got nauseous, well, nausea is a side effect.
Well, that's just it. Everybody's so happy to do the right thing, you know, instead of doing the right thing, we don't. You know, we had, in the Detroit area yesterday, we had 2 people that were fighting. So, what does a teacher do? She goes and grabs a broom, you know, trying to break them up, so she gets fired. Yeah. You know, now if she would have just sat there and let them kill each other, well, they were going to get sued because she didn't do nothing. You know, so it's like a 20-20 catch. You don't know what to do. You know? Right. So a lot of times we don't do nothing. We just keep...
I think that's the next show. This is 2 weeks in a row. I think we've touched on tort reform, which is non-existent in the United States.
Again, you know, it goes back to, I'm going to throw another fly in the ointment on the is that I'm part of a literacy summit that meets with many different agencies, and we're working on some of the challenges with reading and basic skills in Flint. And one of the numbers I saw was 70% of, and I'm going to get the numbers wrong, I think, off the top of my head, but something like 70% of Flint High School graduates are in remedial reading programs when they enter Mount. And so think about that. Think about what I just said. How many of them can read the 6-point font addition that comes in your prescription package?
Yeah, there's no way.
Seriously. I mean, I wear contacts in reading classes, and I get halfway through and think, oh, come on. You know, seriously, you just show me the chemical components of this thing. I have my tooth hurts. Please. So I'm wondering whether or not we're setting ourselves up in very many ways to fail. And so it's It's looking at, so people ask me, I work at this, the substance use treatment agency, right? I'm focused on being able to provide quality substance abuse treatment, and I sit on a literacy summit. It's like, well, they've got to be able to read what we're treating them. And we're back to hope.
Right.
How is somebody going to rebuild a life built on hope and recovery if they don't feel like they have any other options? And some of that means, having the basic skills and the literacy know-how to be able to build a better life for yourself. So we have so many different pieces of this pie that needs to be integrated. In my mind, this is all about, like you said, sitting down at the table, clearing it off, and saying, whatever we were doing before obviously was not effective. We're going to have to redesign a wheel. We're just going to have to. Which is why I really appreciated Community Parent Incorporated, is that you had all these different people and professionals from many, many different areas who were sitting down at the same time. You had substance abuse professionals and judges and people that knew tort reform and people that knew the medical field and people that knew the corrections field and people that knew public relations and people that knew computer design. Everybody sitting down together and saying, listen, this is what I've got to bring to a table. What have you got? Instead of talking about what I don't have or what's the problem with the other groups, it was, okay, this is a group of parents, what do they have? This is a guy who has a game trailer, what does he have? And starting to look at everybody bringing forward, what do you have as a shareable resource, or again, just knowledge and understanding or ideas. I mean, you can imagine how many of us that have been in the field for 20 and 30 years frequently are faced with where it's this problem rolls in, and it just seems like this big gigantic tidal wave, and your first response is, I got nothing. I really don't. Our agency, luckily, is the way the culture of our agency is. In those situations, we just look at the consumers, the residents in the program, or somebody else, and says, okay, what do you guys think? You're the ones that just came in off the street. You're the ones that are using this. You're the ones that have hands-on experience 10 days ago. What do you want to see? Because what works for me might not be practical for everybody else. And that again is where we start looking at going into the high schools and asking the kids, what do you think?
And I think we have to get back to the root cause. Like you're saying, if you're looking at society and that hopelessness, mm-hmm. or a lack of hope, however you want to word it, you look at the change in the fabric of our nation. Mm-hmm. And I'm not talking about demographics. I'm talking about, well, some of this demographic data, but I'm talking about just the change in society from two-parent homes to single-parent homes to nuclear and extended families to people who don't know who their cousins are. There's the whole faith component. The Supreme Court on Monday just upheld the ruling to say prayer at the beginning of government meetings. That was under attack. There's a school in Fort Collins, Colorado, that changed the Pledge of Allegiance to say "One Nation under Allah" during as a cultural experiment. And we go into the schools, and we're not allowed to even say anything about God or spirituality. Yet you walk through 3 metal detectors to get to that auditorium, and I understand that, there has to be balance, and you don't want to impose your views, especially very personal views. This isn't reading, writing, and arithmetic on an individual, but we're failing our kids. And that's why I love the name of our organization as Community Parent, in that it really comes down to, we're going to be educating and making the kids aware, but and Sam, you and I have talked about this time and time and time again. What we've got to do, and that's important because you got to catch them while they're young. The DARE program, in my opinion, just failed. That's, I don't care, send me hate mail. It failed. So we're going after these middle school and high school kids because they're right in the midst of it. There needs to be an effective program at a young age that talks to them differently than we do, but then the parents have got to be, the parents can't take this hands-off approach and say, you know what, my kids are going to school, they're going to get taught it there, we don't have to reinforce it at home. And I was guilty of that as anybody. I said, you know what, I can send my kids to this school and this school, and what I'm not going to teach them, they're going to learn, and that should be good enough. Leave me alone, I have to go to the doctor, go get my prescription filled, and I'm going to go check out on the couch for 4 days. Yeah, what am I teaching? So,
I think through life, what we've had is we've had these 1% or 2% that were not good. They just, whether it was a teacher or whether it was a pastor, or whether it was a Boy Scout leader or whatever, we looked up to these people and they failed us. So we changed, or we come up with these laws, and it made things worse. When I was going through the system with Brianna, I was looked upon like I was a bad parent, and I didn't really get it. Now we were at Northwestern, and what I seen there, same thing I seen at Bendel, is there's a lot of these good kids.
oh, absolutely.
They're in a bad situation. They're probably in a single family. Their parent is on drugs or an alcoholic or something, and these kids are forced to grow up before their time. So now they need money to support their family, and what do? They turn, how am I going to make some quick money? So we see these where they're selling their dope or whatever to make the quick buck. I didn't really understand when I was going through the system that I'm not a bad parent. I was there for my daughter. I was fighting for her all the way. So now, as over 40,000 kids we've been in front of, and I see why we got there. But the whole thing is, we don't ruin something because of a few bad apples, and when we make mistakes, we took God out of the school, maybe it's time to go back.
Yeah.
Because they're obviously not getting these faith values at home. It's okay to say under God, the same thing, getting us a paddle. I mean, I got a paddle when I was at school. My principal says, you've seen me 3 times. Okay, now you're going to get a paddle. 1 spot for each time I had to see you. It didn't kill me, I had something to fear. Now there's no fear of anything, whether it's a paddle or having God in your life. These are definitely moral issues that we really need to bring back to the table, back into our schools, into our society, and we'll just keep getting further and further away. We have a pastor that speaks with community parent, and we were talking, and he says, time is getting near. Well, whatever your faith or whatever, I'm not here to preach, okay? But I do believe that Satan is making his last stands, and he's trying to take as many as he can with him. And we need to come together as a people and say, enough is enough. This isn't working or whatever, but how things used to work is we were a village. We all looked out for each other. There is no love anymore. Nobody wants to get involved, or because everybody is so happy.
Well, we were talking about this the other day. I said to Sam, when we were a kid growing up, this is before the telephone and TV, and even before the automobile, I think, with Sam. But when did you have to be home?
When it got dark.
When the street lights came on. Mm-hmm. And when you got in trouble, did you just get in trouble from your parents?
No.
You got in trouble from everybody all the way home. Aunts, uncles, neighbors, you're in for it when you get home, and don't come crying over here. Now, you don't even know who lives next door to you. And in 18 years of coaching, the hundreds and thousands of kids that I've coached, I've never met a bad kid, but I've seen plenty of bad parents. Kids are not born bad. They learn what they live.
I spoke to a lot of teachers, and a lot of times they have problems with the kid, and what they do is they'll reach out to the parent, and the parent you know, instead of listening to that teacher and see, how can I help, you know? How can we make this better? Oh, there's nothing wrong with my kid, and they'll just, you know, go the opposite way. And they make the teacher like, okay, you're bad. Not all teachers are bad either, you know, but I'm just saying. They have our kids for 7 hours of the day, you know, maybe we need to listen to them, you know. A lot of times they see problems in a child a lot before, you know, our parents will, because they're seeing them more. You know, by the time they get home, you feed them, they do their homework, they're off to bed.
You hope.
And it goes back to, again, one of the things that you were talking about was community. I mean, I got involved with Community Parent because I grew up in your community. That's what it was. And so I went to school with several of your sisters. I don't even know how many sisters you have. I know there's several.
How many brothers? You're the only boy. Oh, that explains so much.
Doesn't it? But
You should see his shoe collection. He has more shoes than Imelda Marcos. I'm sorry.
so, right. But anyhow, so several of your sisters, right, that I remember from high school and from elementary school, just being around the community, and I probably got in trouble on the same route home, partially there, by several neighbors. And it goes back to letting communities define what's the morals of the community, let the area define what they feel is important, define their spiritual background, their guideposts, their school expectations, and to let this community find itself and empower communities to be able to do that instead of coming up with ways to undermine the communities. And that's one of the things I think is powerful when you start looking at, if a community comes forward and says, hey, this is what our problem is right now. This is what we're struggling with. We're struggling with heroin. And then another community says, yes, but we've had 7 bullying-related suicides. So I don't want to talk about heroin right now. I want to talk about what is going on in our, you know, these kids thinking that this is an option to being picked on or harassed at school. Or we're looking at, you know, a rash of students setting fires or break-ins or gun violence or, right. And so looking at ways that we can empower communities to respond to specific community needs and have support for that seems to me I guess you could say the most logical and achievable response, because again, you know, as you start looking at these big gigantic problems, it's easy to feel overwhelmed, and then we live in an extremely polarized country. I mean, I'm always amazed and sometimes entertained by some of the things that happen on Facebook between friends. Somebody will post one of those little memes and then, you know, fight erupts. And it's like, really, if you guys listen to each other, you realize you're saying the same thing at a level. It's just we feel the need to argue about it, which is why I don't like marriage counseling. It's the therapist. You're like, okay, you guys are agreeing. Will you stop fighting about how you agree? But letting communities build together, work through that polarization, start coming to win-win situations that are not that hard to achieve, and in coming up with ways that we can clear up the table, we can start sharing resources across the board, and we can start looking at how can we come up with something that's achievable in 2 months, like Chasing the Dragon. What can we accomplish by the end of the summer that we can make an impact with, and then we'll have the think tank still working on what happens once school goes back to work or goes back, and start making these small incremental steps towards doing something long term where we're not able to do that short term.
You know, it's a great message right there. I mean, that was the reason that Community Parent really got together. We had 2 deaths in our town, but there was 3 deaths before that of young people. You know, 3 were from Xanax and alcohol, and then 2 more, you know, from the heroin. And I think the big thing, Tony Brown and Representative Graves, they knew my daughter and Bob Krug because they coached her. And it was like, I used to think the same way that, addicts were just, this is their choice, and they're just bad. And I think they got a rude awakening that this happens to good people in good homes.
Absolutely.
And that's why a community parent actually got together, and I was reading somewhere where it's the grassroots, these little communities that really, they're the ones that make the change. They're the ones that make things happen. So, we do this radio show and stuff. It's because I say this all the time, one hand can't clap by itself. And not only do I recruit at the schools, to join us, but we want everybody to come aboard and help us to make a change, to get rid of addiction out of our communities, because it doesn't matter if it's 5% or 10% that these become addicts, it affects your whole family. It affects everybody in the community, the neighbors, the police, and it affects everybody. So join us in this fight, because together we can make a difference. So
I think that's the key too. What both of you just brought up is, before I mentioned how it seems so overwhelming. You look at all the different agencies involved, all the different individuals, all the different addictions, all the different problems. But if we can, at the grassroots level, on the community basis, the neighborhood basis, start out in the neighborhood, start out on the block if that's what you need to, depending on where you are, and say, this is what we're going to tolerate, this is what we're going to accept and what we're not going to accept, and come together. Well, pretty soon that one block becomes 2 blocks, becomes 4 blocks, and you do see successes happen that way.
Right.
You truly do. It's a lot easier, and it's a lot easier and more measurable to look at it that way than to say, okay, let's look at the zip code, or the ward, or the district, or the whatever. You just take how do you eat an elephant? A lot of small bites.
Right. And we saw that as an organization. We saw that with the first house that was purchased by Odyssey House. That's why our name is called Odyssey House. It started with one house. And somebody just got done talking about, several of your properties, and so now it's Odyssey Village that we refer to ourselves as because of that. It's just slowly. And some of the pieces of the organization, there's STRIVE, which is Workforce Development. There's the Health Awareness Center. There's all these different elements, because people are very complex and have a lot of complex needs, and they need to blend out around that. And that's one of the things is that allowing everybody that comes in to do what they do best. And I'm going to, I normally don't like to kind of front out, but I think communities work best when you have the old downtown street focus, where the plumber was the plumber and the electrician was the electrician, and we didn't have these gigantic Walmarts that tried to be everything to everybody and kind of stay in your lane, but recognizing the idea that everybody has something valuable to contribute, and allowing that piece of it to be their best.
Yeah.
And to start sharing.
it's great.
Again, if I take 25 Matchbox cars and you have 25 Matchbox cars, we've got 50 Matchbox cars, right?
Exactly.
And we forgot that as adults in this community. We forgot that, and we need to go back to playing that way, and doing some healing and resource sharing, and that's what we need to get back to.
Well, let's try to take that rifle shot approach versus a shotgun, and saying, if I try to be everything to everybody, or if I try to make everybody happy, I'm going to make nobody happy. If I try to be everything, I'm going to end up being, I'm not going to be good at anything.
Right.
So, and again, the only way you can do that is at the community level.
Absolutely.
You can't do that even at the state level, county level. It can grow to that, but it has to start. You look at some of these initiatives that have taken place, even in our own city here, where there's been several tragic deaths. Whether they're it all comes back to drugs, alcohol, or a mental health issue. A lot of times at the root, and either there's a murder or a home invasion or a drive-by or an accident or something. And it's when the people in the neighborhood say, you know what, enough. And they start doing anything from watch groups to, you know, any of the different grassroots community initiatives that happen. Those are where you see a lot of success.
Exactly. Community Parent, we are going to be in Southwestern High School on Monday at 9:15. And again, we invite you all to come, check us out, hear what Chasing the Dragon's all about, and join our group because we need your help. One hand doesn't clap by itself. I will keep repeating that until, you know, you hear me and you join. Because everybody needs to get involved. Because this is going to end up at your doorstep. There is no family that's not being touched by drugs and alcohol.
No.
Everybody is touched by this crazy disease. All right? Again, we're going to be at Southwestern. We're going to wrap up our year at Southwestern High School. We are looking at putting some programs together for the summer where we're going to be doing evening presentations of Chasing the Dragon for all the adults to come. And bring your kids or whatever. And I will let you know about those as we get closer to them. But I think this program is really touching home, and people can feel it. And you know, we'll have people as soon as they see the pictures or I start talking or whatever, you'll see them crying and leaving the room because it touches home. Mm-hmm. They can relate to what we're saying. They can relate to the pictures or whatever, because it is happening in their homes. And the whole thing is, when I was going through this in my home, I was very embarrassed. I didn't want nobody to know what was happening because of the stigma, you know, behind it. But let's break the stigma, and that's the only way we can heal, you know, as a people, is by bringing it out. And how do we heal? How do we get better? You know, is by working together, every one of us. And we want you to join us. We want your ideas. We want your feedback. You know, how we can make this great. I think we really have a great program going, and at least we are trying to find solutions. Okay. The whole thing is, when we came up with the Chasing the Dragon, it was about stopping the nosebleed because we lost 5 people in one community. But the whole thing is, it's not just happening in that community. It's happening in every community across our nation. Every community is touched by drugs and alcohol, and I want to kick its ass. How about you, Charlie?
I'm ready.
Kristen, we really appreciate you coming in today.
Well, thank you for having me.
Definitely, and not only do we appreciate you coming in today, we really appreciate all your support for Community Parent. And you know, if anybody's struggling out there, Odyssey House is a great way to get cured or healed. You know, find a solution right here. Okay. We love having you aboard. And again, Southwestern High School is a wrap-up. This is the last presentation of the year on Monday. What is that, the 12th?
Yes.
Monday the 12th
9:15.
at 9:15. 9:15. I want to say a big thank you to Northwestern because they were awesome.
Yeah, those kids were fantastic.
They were very receptive. We felt your pain because we've been there. Okay, every one of the presenters have been in your shoes, have felt your pain, and just stay strong. You know, stay sober, and do what you need to do for yourself and for your families. And that doesn't just go out to Northwestern. That goes out to everybody that needs to be healed. Okay, it starts with your own. It starts with that person on the other side of the mirror. Okay, change has to start there, and no one can make the change but you. Okay. CommunityParent.org. Reach out to us. You know, we're here to help. Whatever we can do for you, we'll be glad to. Okay? If somebody in your family is struggling with addiction, we will help you to find help. We will do whatever we need, whatever is, we can do for you. We don't turn our backs on nobody, okay? And we're just here to help. And this is just another avenue that we have to get our voices out. But I think, one voice, two voice, the louder we are, the more things are going to get done. We're working on a lot of different avenues. We took this to the schools because 12 and 13-year-olds, this is what they're doing. They're starting out with prescription drugs, okay, or weed, or alcohol, or whatever it is, okay? So we give you an avenue to see where it could lead to, okay? So get help before it goes anywhere any further than that.
And know what you've got in your medicine cabinet. It's not just the bottles, but I think of NyQuil and Benadryl, NyQuil. I lived in a three-quarter house with a young man who was drinking hand sanitizer.
Yep.
That's
I
crazy.
can't even imagine. Oh my God!
Well, the whole thing is addiction.
I thought scotch was bad.
Will make you do the craziest thing. We heard about that. The grandmother. Nothing is crazy when you're on drugs, okay? It will take everything from you. You will become a person that you don't know who you are. Okay, thank you very much for coming in today. Thank you for listening. We love you, and that's why we do what we do. All right, join our cause.
And don't forget, Odyssey House. Find them on the web.
Yep, www.odysseyvillage.com.
We out.